Hi, welcome to our telehealth medicine information video. I'm Garvin and this video is on Salamol Easi-Breathe inhaler. So Salamol Easi-Breathe is a salbutamol inhaler, or the blue inhaler or reliever. It is breath-actuated, meaning that the inhaler releases a puff of salbutamol automatically when you breathe in. This type of breath-actuated inhaler is particularly useful for patients who have difficulty using the standard inhaler. Standard inhalers require the user to push down on the end of the inhaler canister at the same time as inhaling in. Some people find this coordination difficult and benefit from the automatic triggering from a breath-actuated inhaler. So in common with other salbutamol inhalers, the Salamol Easi-Breathe inhaler is used to relieve the chest tightness of asthma. It is used when required, so 1 or 2 puffs are taken to relieve symptoms for up to 6 hours. So Salamol Easi-Breathe and other salbutamol medicines are used to open up the airways and make breathing easier in people with breathing problems, so including asthma, chronic obstructive pulmonary disease. So it's used for those two. Salbutamol inhalers like Salamol are blue and known as relievers. They work very quickly to open the airways and are used when needed to relieve asthma attacks, wheezing, coughing, chest tightness or shortness of breath. If your asthma is triggered by exercise or allergies, you can also use your salbutamol inhaler shortly before exercising, or if you know you're going to be exposed to allergens that trigger your wheezing, such as pet fur or pollen. This will open up your airways and help prevent wheezing. So how does Salamol work? Salbutamol is a type of medicine known as a short-acting beta-2 agonist. It works by stimulating receptors in the lungs called beta-2 receptors. This causes the muscle in the airways to relax and allows the airways to open in conditions like asthma and chronic obstructive pulmonary disease, or COPD for short, emphysema and chronic bronchitis. The airways become narrowed and it's difficult for air to get in and out of the lungs. By opening the airways, salbutamol makes it easier to breathe. So how do you use Salamol? First of all, always follow the instructions given by your doctor regarding when to use your Salamol inhaler and how many puffs you can use each day. Don't exceed the prescribed dose from your doctor. It's very important to learn how to use your inhaler correctly, as otherwise you won't be breathing the right dose of medicine into your lungs. So instructions will be provided with your inhaler. However, your doctor or pharmacist can also show you how to use your inhaler and can check you're using it correctly. So using the inhaler, first, patients should shake the inhaler vigorously. So this is the inhaler. So give it a good shake first. The inhaler must be held upright. Patients should open it by folding down the cap which fits over the mouthpiece, which is this bit. Patients should exhale normally and place the mouthpiece in their mouth with their lips closed around it. They should hold the inhaler upright and make sure that their hand is not blocking the air holes. Inhalation through the mouthpiece should be slow and deep. Patients should be advised not to stop breathing when the inhaler puffs the dose into the mouth. After that, they should carry on until they have taken a deep breath. Patients should remove the inhaler from their mouth and hold their breath for 10 seconds or as long as they comfortably can, and then exhale slowly. After using the inhaler, patients should hold it upright and close the cap immediately. If more than 1 puff is needed, patients should close the cap, wait about 1 minute, and then start that process again. Patients should be advised to clean the inhaler once a week, especially the mouthpiece, to prevent deposits from the aerosol building up. So as with most inhaled medicinal products, the pressurized containers, the therapeutic effect of this medicine may decrease when the container is cold, so the container should not be punctured, broken or burnt, even when apparently empty. The metal container must not be put in water. So full instructions for use are given in the patient information leaflet which comes with the product. Salamol should be used with caution by people with heart disease, people with irregular heartbeats or arrhythmias, people with high blood pressure or hypertension, people with an overactive thyroid gland or hyperthyroidism, people with diabetes, people with a low level of potassium in their blood. So next question, is it safe to use Salamol in pregnancy? So it's important that asthma is well controlled in pregnant women because severe asthma attacks can be dangerous to the pregnancy. Whenever possible, asthma medications should be taken by inhaler, as this minimises the amount of medicine that enters the bloodstream and crosses the placenta. Salamol inhaler can be taken as usual during pregnancy. For further medical advice, talk to your doctor about this. Is it safe to use Salamol if you're breastfeeding? So salbutamol may pass into breast milk in small amounts. However, in general, salbutamol inhalers can be used as normal during breastfeeding because the amount of Salamol medicine that passes into the breast milk after using an inhaler is negligible and unlikely to harm the baby. So for further advice, if you have asthma and you're breastfeeding, speak to your doctor before using this product. Possible side effects of Salamol, so feeling shaky, headache, faster than normal heartbeat, feeling tense. These wear off a short time after taking a dose. Heart palpitations, muscle cramps, mouth or throat irritation, flushing, feeling sick or vomiting, and sleep disturbances, hyperactivity in children, low level of potassium in your blood, and people with severe asthma should have regular blood tests to monitor the amount of potassium in their blood. This is because low oxygen levels in the blood, or hypoxia, and various asthma medicines, including this one, can lower blood potassium levels. Can you use other medicines with Salamol? So you should check with your pharmacist or doctor before taking any new medicine while you're using salbutamol inhaler to make sure the combination is safe. Is it safe to take different medicines together? So people who are using salbutamol should not take medicines called beta blockers such as atenolol or propranolol or timolol. This is because beta blockers have an opposite action to salbutamol and can cause the airways to narrow, resulting in breathing difficulties for people with asthma or COPD. So this problem has also sometimes been seen with eye drops containing beta blockers, which are used for glaucoma. So salbutamol can sometimes cause the level of potassium in your blood to fall. So the following medicines can also have this effect. Corticosteroids, such as beclometasone and prednisolone, diuretics such as bendrafluothiazide and furosemide, other beta-2 agonists such as salmeterol, the xanthine derivatives such as theophylline. Since a low blood potassium level can have serious adverse effects, people with severe asthma or COPD who may be taking several of these medicines should have their blood potassium levels monitored regularly. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact us through our website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork, or ring 436-6923 to find out more. Thank you for watching. Stay healthy and stay informed.